Hello and welcome everyone to Dr. Nguyyen's YouTube channel, your trusted source for health insights and advice. Today we're diving into a topic that holds relevance for so many of us, yet is often misunderstood: depression. We'll be exploring this condition from various angles, navigating through its overview, causes, symptoms, and diagnosis. We'll also delve into the different treatment options, both medical and non-medical, and look at potential complications and preventative measures. Understanding depression is not just about knowing the medical terms. It's about comprehending how it affects our lives, our relationships, and our overall well-being. It's about acknowledging its presence, breaking the stigma, and creating a safe space for dialogue and support. Depression is complex, yes, but it doesn't have to be intimidating. So let's journey together, breaking down this intricate issue into simple, digestible information. Join us as we unfold this complex issue in a simple, straightforward manner. Depression is more than just feeling sad or going through a rough patch. It's a serious mental health condition that requires understanding and treatment. Imagine a cloud that follows you around, casting a shadow over your everyday life, making even the simplest tasks seem arduous. That's how depression can feel. It's not a fleeting emotion, but a persistent state of despair that can affect every facet of your life, from your appetite and sleep to your relationships and work. Depression is also far from uncommon. It's estimated that hundreds of millions of people around the globe are living with various forms of this condition. It affects people of all ages, from all walks of life, and in all countries. Depression doesn't discriminate. It can touch anyone at any time. Depression affects millions worldwide, but it's important to remember that it is a treatable condition. Depression doesn't have a single cause. It can be triggered by a combination of genetic, biological, environmental, and psychological factors. Let's unpack this a bit. Some people are genetically predisposed to depression. It runs in families, suggesting genes play a significant role. However, not everyone with a family history of depression will develop the condition. It's a complex dance between genetics and environment. Biological factors also come into play. Changes in the brain's neurotransmitter levels, specifically serotonin, norepinephrine, and dopamine, are often associated with depression. Moreover, hormonal imbalances or changes, such as those occurring during pregnancy or menopause, can also trigger depression. Environmental factors cannot be underestimated. Exposure to violence, neglect, abuse, or poverty may make some people more susceptible to depression. Similarly, psychological factors such as low self-esteem, being overly dependent, or facing chronic disease can also kickstart depression. Now let's shift gears and talk about the symptoms. Depression often starts off subtly. You might feel persistently sad, anxious, or empty. You might lose interest in activities you once enjoyed. You may experience changes in appetite or weight, sleep patterns, and energy levels. Sometimes it manifests as feelings of hopelessness, guilt, worthlessness, or helplessness. It's not just an emotional state. Physical symptoms can also appear, such as headaches, digestive disorders, and pain that doesn't respond to treatment. Depression can also lead to thoughts of death or suicide. It's crucial to take any such thoughts or talk very seriously. If you or someone you know is in this situation, seek help immediately. Remember this: depression is more than just feeling blue or having a bad day. It's a serious mood disorder that requires understanding and medical care. Recognizing these symptoms is the first step towards seeking help and getting treatment. After all, you cannot address what you do not acknowledge. So let's continue to discuss, understand, and confront depression head-on. Scene script. Diagnosing depression involves a comprehensive evaluation by a healthcare provider who will ask about your history, symptoms, and lifestyle. When it comes to diagnosing depression, it's not as simple as taking a test. It involves a thorough assessment by a medical professional who will ask about your personal and family history, your symptoms, and your lifestyle habits. They may also conduct physical examinations and lab tests to rule out other conditions that could be causing your symptoms. Depression is typically diagnosed based on the presence of certain symptoms that persist for at least 2 weeks. These symptoms can include feelings of sadness or hopelessness, loss of interest in activities you once enjoyed, changes in appetite or sleep patterns, and thoughts of death or suicide. Once a diagnosis has been made, treatment can begin. Treatment for depression can take various forms and often involves a combination of approaches. Medication is one of the most common treatments. Antidepressants can help to regulate your mood and alleviate the symptoms of depression. However, They're not a quick fix, and it can take several weeks before you start to feel their effects. It's important to speak with your healthcare provider about the potential side effects and to find the medication that works best for you. Therapy is another essential component of treatment. Cognitive behavioral therapy, interpersonal therapy, and problem-solving therapy are all effective in treating depression. They can help you to understand and change thought patterns that lead to depression and to develop better coping skills. In some cases, other treatments may be recommended. These can include electroconvulsive therapy, or ECT, and repetitive transcranial magnetic stimulation, or RTMS, for severe depression that hasn't responded to other treatments. Treatment plans should be individualized, taking into account your specific symptoms, the severity of your depression, your personal preferences, and other health conditions you may have. The road to recovery can be long and challenging, but with the right treatment and support, it is entirely possible to manage depression and lead a fulfilling life. Remember, it's essential to seek professional help if you think you may be suffering from depression. Scene script. Beyond medication and therapy, there are other non-medical treatment options for managing depression. Let's delve deeper into these alternatives. Firstly, lifestyle changes can have a significant impact. This includes maintaining a balanced diet, ensuring you're getting enough sleep, and avoiding alcohol and drugs, which can exacerbate symptoms. Small changes can make a big difference. Next, let's not underestimate the power of exercise. Regular physical activity boosts your mood by triggering the release of feel-good hormones called endorphins. Whether it's a brisk walk, a yoga session, or a vigorous workout, exercise can be a natural and effective way to combat depression. Additionally, mindfulness and relaxation techniques such as meditation, deep breathing exercises, and yoga can help manage symptoms. By focusing on the present moment and fostering a positive mindset, these practices can reduce stress and promote a sense of well-being. But what happens if depression goes untreated? The potential complications are wide-ranging and serious. They can include physical health problems such as heart disease and obesity, as well as substance abuse. Untreated depression can also lead to severe emotional pain and suicide in extreme cases. Early detection and treatment can help prevent these complications. If you or someone you know is showing signs of depression, it's crucial to seek help immediately. There are numerous resources and professionals out there ready to provide the necessary support. Remember, it's okay to ask for help. In fact, reaching out is the first step towards recovery. It's also important to stay connected with loved ones who can provide emotional support and encouragement. Moreover, self-care activities like taking time for hobbies and interests can also help manage symptoms and prevent depression. It's essential to remember that everyone's experience with depression is unique, and what works for one person may not work for another, so it's all about finding what works best for you. Depression is a complex condition, but with the right knowledge and resources, it can be managed effectively. And remember, you're not alone in this journey. There's a whole community of people out there who understand what you're going through and are ready to help, so don't hesitate to reach out and seek the support you need. Depression is a serious but treatable condition that affects many people around the world. We've journeyed through the complex layers of depression, from its overview, understanding its causes, recognizing its symptoms, to methods of diagnosis. We've explored both medical and non-medical treatments, shedding light on the potential complications and emphasizing the importance of prevention. Depression is not just a bout of the blues, it's a profound sadness, a void that may seem impossible to fill. But remember, it's a condition that can be managed with the right course of treatment, be it through medicine, therapy, lifestyle changes, or a combination of these. The road to recovery may not always be smooth, but it's a journey worth taking. It's crucial to acknowledge that it's okay not to be okay, and seeking help is not a sign of weakness, but a step towards healing. Thank you for joining us on Dr. Nguyen's YouTube channel. Remember, it's okay not to be okay. Seek help when you need it and take care of your mental health.